Awesome. So I will just give a brief intro, and then as we go into each of the panels, Bodhi and Monica will have our speakers provide some introduction to themselves as active users and voices within the different tiers or options of supports that we offer. And have really used the voices of those that we work with to inform and iteratively develop. So you can see some of our core hands team reflected here at the top of the page with myself, Kristen, Bodhi, and Monica. And then our most important partners here within the conversation today are reflected below with Levi, Itara, Maria, Marissa, Sarah, and Deb. So respectively, they will each share as we get going with the panel for each of the levels. That way you have it closer in context to when they're speaking as well. Specific to our center, we have operated since 2004. So a little over 20 years as an interdisciplinary training and resource center that has continued to scale and expand beyond our state, more nationally and globally. We operate as a small business or auxiliary within Indiana University and ultimately maintain the core missions of Indiana University in that we are practitioners by trade. So again, I'm a psychologist by trade, and then we have other practitioners on our team, and the panelists respectively will speak from their perspectives and their roles. We spend a lot of time in our center in outreach, education, and training. Everything that we are training, we're also doing as practitioners, and again, really working alongside those that we serve. And then on the research side, we really focus on that practical implementation piece, which is what we'll talk through today. Ultimately, we're working to align with our mission and vision in not only training and really delivering those core missions of Indiana University, but really providing unique interactive opportunities to build cross-system bridges of information and building local capacity specific to those that effort. In terms of our trajectory, we have been around, as I mentioned, for 20 years. So you can see we started with foundational funding through the Centers for Disease Control and Prevention, which is where we developed our comprehensive training model in 2004. And then from that point forward, again, have continued to scale and meet state needs. Again, with an eye always in being agile and adjusting to the funder, as well as making sure that we're delivering in terms of the audience that we're serving in that approach. So you can see progressively in developing our model, the question was then, what does that look like in the community, and developing demonstration sites. Moving forward with part of what we'll talk about in terms of really having the community voices reflected in development of community cadres and really having that community voice reflected in 2009, 2010. And then progressing forward in terms of setting ourselves up to better represent the communities we're serving as an auxiliary. And one part that we'll also talk about today with the panelists is our role as IAC facilitators. So you'll see we started that in 2014 and then began serving more on the adult side with our VR and pre-ET services. Again, continuing to meet state needs and listening to the voices of those we're serving in terms of what that looks like. In the more recent 5 years, we've continued to expand in terms of providing coordinated care and really bridging across systems, again, in working with our hospital networks across the state. And then moving towards scaling and really building capacity through our research and service mentoring network, and then scaling further in terms of global sites. The last part, which our ECHO discussion at the end we'll talk a bit about, as well as our internal coaching, which we won't touch upon today, is really focused on micro-credentialing and badging to, again, develop that capacity within communities and continuing to expand our partnerships and options. So in terms of our work, and again, before we get into kind of the tiered components that'll allow some of that discussion around really the user-centered or human-centered design, we have a comprehensive and agile treatment model. So you'll see there is our comprehensive training process, framework, and curriculum. that we have now used for over 20 years and are really working on expanding and manualizing that. We've been able to demonstrate its responsiveness across multiple settings in both research, so showing changes in knowledge, application, and implementation, but also applicability from home settings to early childhood, transition aged, and adulthood in terms of really building the environment, setting up for success and working with the individuals, and then individualizing that teaching across multiple disabilities, settings, and service needs. Part of what we'll focus on today is really looking at our accessibility of supports across multiple options. So that blue triangle that you see there is very similar to Bloom's taxonomy of learning in terms of meeting people where they're at in terms of the service or learning materials that are at the level needed. So I'll talk further, as will Bodhi and Monica, as we go through in terms of those levels. And then we have panelists today that'll talk a little bit about how that, how they've been involved in that iterative process from that community and stakeholder lens. The other part that we'll talk about is reflected here in this green kind of inverted pyramid, where what we use is what we call vertical and horizontal integration to make sure we are delivering a support or a resource or a training or being that organization that can offer that at the level needed. But again, that we're reflective of the voice so that each level is hearing a similar language, but across all levels within a system, they're sharing common resources and, again, language. The way we do that, again, is through partners like those that we have on the call, through our collective impact model, and our broader autism and engagement network that allows us to really empower voices of the stakeholders and those that we're really working to represent and the audiences that we're serving across all of those efforts. So today we're going to focus on the horizontal and vertical integration components and across that network piece.
And really quick, Tiffany, could you, as you go through these slides, could you describe just the little visuals that are included? And also, I love Bloom's taxonomy. It's like my favorite. Can you give just a little sneak peek about, some people may not know what that is?
Absolutely. And that'll be a specific section that I'll dive a little bit more into. I break all of those visuals out into bigger pictures here in just a moment, if that will work. But I'll keep that in mind as I go through. Is that okay?
Yeah, that's perfect. Thank
Awesome.
you.
Yeah. So the way that, or what we really want to focus on today, in that kind of broad description of what our center does and really the voices that we look to represent in the services and supports that we offer, is how we really keep an eye on innovation and human-centered design. So I just wanted to reflect here that over time, part of the unique piece about using innovation, making sure that we're always talking to those that we're serving, as well as following a systematic process, is just calling out again, over our more than 20-year history, we've had diverse funders. So everyone from federal to state to local to foundation funders. But our eye has always remained on that human-centered design piece and really focused on knowledge transfer and getting practical tools in person's hands, or that were representative of those that most needed that support based upon that funding source. So again, just reflecting kind of that diversity in research funding versus training and service funding. So what I've reflected in the images is, again, despite the funder, that we've really tried to keep a center and always involve or co-create the resources that derive either in research, as I'll kind of go over, or in the training and service side. Next slide. An example I want to share here of our implementation process, and as we get into, again, the panel discussions, is that for every project that we undertake, we do follow implementation science and the stages of the implementation process. So as we're working through an exploration and adoption phase, really learning about the audience, learning about those that are receiving the information, and making sure we have representative voices and sampling. One example of that is more recently when we were working with our state Family and Social Services Administration. They really wanted to look at what are the needs of families that are waiting for services or on Medicaid waiver services. And even at the exploration and adoption stage, really tailored that approach with a three-tiered approach where we mailed out specific blue envelopes with a one-page letter, followed that up with a postcard, and then the third tier was a brief email. And we saw in a broad census survey that we had over 11% of the population surveyed with positive responses and very robust results. So again, really trying to meet or match the approach with the audience that we're working with to make sure that it's representative and in formats that best meet their level and access. So the part that we'll focus on today is really that next phase of the implementation process with program installation, as well as once you're in implementation, what that iterative development cycle looks like. So with program installation, there are two parts that we look at here, and there are transitions within the slide. So for horizontal integration, that's the green circle. If you advance the slide one more time, that really focuses on level by level, what that level needs or the alignment of needs and formats appropriate to that level. So the content that individuals with disabilities or individuals with autism need may look very different than our policymakers or our state level management staff. So horizontally, looking at how they learn best, the outlets that they receive information from, and really meeting their needs in the formats, the length, the content areas that are most appropriate. That next level, which is the second transition that I had layered in, is really looking kind of vertically and integrating and getting people on the same page, but also empowering and making sure that we're sharing a collective voice. So always working with our focus groups, connecting with those that are joining or that we're working to elevate their voices in the conversation. So that vertical integration is an important part for each of our level of service. So again, this is from the implementation science literature in terms of making sure at a level we're speaking a similar language, and then vertically that we're getting everybody on a similar page and not using different language at every level, but helping empower and make sure people are speaking a similar language from top to bottom and bottom up.
Tiffany, do you mind reading out the levels just for accessibility purposes?
Sure. So at the base level, and this is inverted from Bloom's taxonomy, so they kind of juxtapose. We have individuals, and then we move up into direct care staff and caregivers, provider level management staff, state level management staff, and then we go up to more training agencies and centers and state divisions, state agencies, state departments, and federal departments. So again, that's bottom up. So when we're thinking about who we are all here to serve, which are the individuals and families, then those staggered tiers up for supporting those families. On the right side of the visual here is kind of the flip of the Bloom's taxonomy, where our training agencies, centers, state division, state agencies might access things through what we call our level 1 options that we'll get into in terms of dialogue with online learning or informational briefs or things that are very short in duration or accessible just in time. The next level, kind of on that next side, that we'll talk about specific to our ECHO series with the panel, is our interactive workshops, where we're really making those accessible, still in brief chunks, and very focused on singular topics or singular kind of with ECHO case-based learning, but some interactivity, but maybe not at the level of hands-on or more direct application. Moving down the side of that triangle, and again, kind of what we call level 3 or tier 3, observation and consultation, where we're really kind of hands-on, doing more of our intensive trainings. And then at the individual level, or what we would call level 4, mentoring and coaching. And that's for that very few where we really need to go into those more intensive situations, mentor, coach, and train in that way. So you can see the horizontal integration and then that vertical integration there in colors. So for the tiered training, resource and service options, which is really where over time and over a 20-year history, we've continued to evolve, empower, and really equip at each level by really engaging stakeholders like those that are on the call. So giving some description to Bloom's taxonomy here, and I put the added colors there. Level 1, as I mentioned, is that dissemination and awareness area. That's everything from manuals and downloads to the actual tools that we use within settings or that we take and prepare and send out. Another piece that we're going to talk specifically about within the dissemination and awareness level is our facilitation of our state council, as well as how we use those tools through our local cadres and other community work. Level 2, again, these are things that we have iterated and continued to expand over 20 or more years. Level 2, as I mentioned, is really general training and consultation. So you can see in the pyramid, that's what we consider workshop, our traditional instruction, our workshops, and our consultation areas. And those are really where we see our Echo series, our IU Expand offerings, our trainings that are requested by groups. We also run Make It, Take It, and Learn It, Live It workshops, and Next Steps workshop. That again, we continue to revise, get feedback, and really ensure that we're representing our stakeholders. So we'll have a panel that will discuss that Echo component. Level 3 and level 4 are that smaller minority that are going to access or need in terms of our general population. Level 3 is intensive training and consultation. We run 3 and 5 day trainings throughout the year across multiple age groups. Our level 3 and our level 4 are things that we have been doing for a long time and have a long-standing demonstration of efficacy in terms of changing knowledge, application, and implementation. So our focus has been more on scaling and democratizing that knowledge or manualizing those. So today we're really going to focus most on levels 1 and 2. Which are really that broader, everyone needs this kind of knowledge. The discussions are impacted or impact everyone within our communities, and that's really where we want to focus our discussion. So I'm going to pass it off to Bodhi to set the stage for Tier 1 options and dissemination and awareness as we set or support and represent kind of the all, so multiple stakeholder groups.
Thank you, Tiffany. Good afternoon, everyone, or hi, depending on where you're joining in from and your time zone. My name is Boti Ogumola. My first name is pronounced as Bo T. So for anyone who wants to know how to pronounce that correctly. So I lead the dissemination and awareness efforts enhancing autism. And just like Tiffany mentioned, we basically focus on making sure that we create awareness on autism and developmental disabilities across the state of Indiana and beyond. So we're just going to be diving into what that looks like. So in our website, we have ready-to-use materials, just like Tiffany mentioned. We have our library and our bookstore where you can check out some materials are free downloads and some are paid. So one of the ways we leverage technology in creating awareness is by creating an online community where stakeholders come together and we facilitate discussions on how we can create awareness in autism. And one of the online communities we have is the IAC. And just like Tiffany mentioned briefly at the beginning, IAC stands for Indiana Interagency Autism Coordinating Council. And we have a oversight from the FSSA. And what we do is we discuss issues and experiences identified by the state gaps, the statewide gap, and it's based on the Indiana Comprehensive State Plan. And this plan has 8 goals from goal 1 that talks about IAC as a whole, IAC's vision, down to transition and other pertinent goals in the IAC. Can we move on to the next slide? Yeah. So just like I was saying earlier, we have 8 goals. Goal 1 is IAC vision and implementation. We have family and professional partnerships, early and continuous screenings, access to diverse services, transition to adulthood, um, down to cultural responsivity. And what we do is at each IAC meeting, because our meetings are run quarterly, we have we just had our third one in September, and then we'll have the last one in December. And what we do is each meeting we have 2 goals where we discuss these goal. We take 2 goals and we discuss in at each meeting, and our stakeholders come together and we facilitate discussions on how to implement these goals both locally and across the state of Indiana. So just a little bit of data. We have over 63% new stakeholder organization between 2024 and 2025. We have over 2,000 active users on our social media and our website as well. And most of our stakeholders are actively engaged, and we have over 10 countries represented. And some stakeholder organizations include the government, education, community providers, justice and safety, and so on. On our information network website, we have a QR code there if you like to scan and see, like, if you want to join any of our meetings in the future. But from each IAC meeting, we make sure that we are not just having conversations, but we are developing resources that can be useful to our stakeholders, our individuals, family, professionals. And so each meeting, we make sure we create IAC developed resources, and our most recent resource is a resource for advocacy. So we created an IAC developed resource for advocacy, and that can also be seen on our website. And just giving you information on how to be a self-advocate or even advocate for other individuals with disability. So just similar, like I said, the Information Network website was created as a joint effort through the IAC and community members. And it's just another way we leverage technology to make sure that we are creating awareness on autism. And it is a single point of entry where we facilitate both knowledge and services for individuals with autism, their families, and professionals. And this information network page um, has developed a very wide county-wide reach as well as a countrywide reach. And we have multiple users who interface with this website on a day-to-day basis. You can scan the QR code if you want to learn more about the Information Network website and see some resources that you might find useful and helpful. Another online community is the LCC. LCC stands for Local Community Cadres, and this is a regional network of families and professionals, like I said, where we come together and we discuss about autism and other related disabilities. And we usually have subject matter experts where we discuss hot topics about autism. And this is different from the IAC because the IAC is more formal, and all the things that are discussed at IAC are also provided to the state. But for the local community cadres, is more at the grassroots level, and so it's more informal. It's just a space created for individuals, for families, and professionals to just come together and discuss on ways that we can impact our local community. And so we have varying topics that we discuss each month. And this is a monthly meeting, virtual meeting. And we have champions who you're going to hear. We have a champion, Sarah Reeves, our local community cadre champion, who you're going to hear from her soon about how the LCCs might have helped impact her role and also her community. So just a little bit about LCCs in a nutshell. It was first launched in 2010, and we broke out into different cadres in 7 regions. And then, of course, when COVID-19 came, there were some ebbs and flows. And in 2024, we relaunched with the Let's Talk LCC series, which I described as um, an avenue where we can discuss an informal place where we can discuss about hot topics related to autism and how we can continue to push awareness and dissemination. And now we are reestablishing these LCC regions across the state because we've realized that it's important that everyone is empowered and everyone has an understanding of what autism is, especially now where we know that the prevalence of autism has also increased. So this is just our meeting and our recordings. If anyone is interested and wants to know like what this meetings are about. Just like for the IAC, we also have some five-star rating by participants. Participants really find it helpful. And there's always an increase in attendance monthly because people have found this to be important. And you can see on the screen, we have topics ranging from Medicaid waivers to advocacy, mental health resources, and so on. So feel free to scan the QR code if you want to learn more or access these recordings. So similarly, we have the Autism Engagement Network. We all work hand in hand. As you can see on the right, we are the facilitators. Hands in Autism stands as the facilitators for the Autism Engagement Network. And at the state level, like I explained earlier, we have the IAC. And at the local level or the regional level, we have the local community cadres, and then it goes down to our various levels of impact and how we impact the state, regions, communities, and as well as individuals. So like Dr. Neil explained earlier, we have through those levels, level 1 and level 2, we have opportunities for participants to earn micro-credentials and continue education credits. Okay, so we're going into the panel discussion, and I'm going to be engaging some of our Autism Engagement Network members to join the discussion. And it's going to be in no particular order, but I'm going to start with Sarah. So, hi, Sarah.
Hello.
Can you tell us tell us a little bit about your experience being an LCC member and an LCC champion, and then how you would say technology has helps you, or how technology has transformed IEPs for students with autism?
So I work as a coordinator of the autism and essential skills services in our school district. And we're a district of about 12,000 students. So we have quite a few students with IEPs, and I help coordinate a lot of that. And I stumbled across the LCC through just a social media posting because I've always followed Hands in Autism. And I can't remember the exact topic that they were going to be talking about, but I noticed they were virtual meetings right around my lunchtime. And I thought, well, and they were free. So I was like, I'm gonna sign up for this. I just want to see what it's about. And then it turned into me attending every month when we had them, and lots of great topics that were not just geared for students in a school setting, but like for the families and for medical resources and transition services. And it just covers a wide range of things. So that has been super helpful for me. It started out really as a small group, and it has seemed to grow a little bit every month, like Bodhi had said. And I think some of the real impactful things for me, just as being in the schools, is being able to hear from parents. I mean, I get to hear from my parents, and we're a large urban school district, so there were quite a few parents from very small rural communities. So it was really good for me to hear some of the differences in services. Like sometimes I feel challenged, like I'm not being able to do enough for our students, but then I found out we actually do quite a bit, and there are sadly some underserved students in some of our more rural districts. Um, so I became a champion, and I've been one of the subject matter experts, and have really enjoyed being able to help parents. The technology piece. I also serve as our district assistive technology coordinator, so it's always good to hear how kids can use technology. Students with autism really struggle to write, handwriting, fine motor. There's a sensory component. And so we've really pulled in a lot of different ways to use like a Chromebook or an iPad, or different ways to get productive work, and to also pull out a lot of those, teaching them strategies for those poor executive functioning deficits that a lot of our students have. So being able to share those experiences and talk through the local community cadre has been just really fantastic. And I appreciate everything that Hands has done for our state. So.
Thank you so much, Sarah.
Mhm.
I'm gonna circle back to you in just a minute, but I want to ask Marissa. Um, Marissa has also been a part of our LCC and has also been a subject matter expert um, in our LCC meetings. And I just wanted to ask you, Marissa, um, being an individual with autism, how would you say the LCC has empowered you or helped amplify your voice in the disability community?
Absolutely. It has helped significantly. So I'm autistic. I'm the owner of Independent Pathways, and I am also ASEC certified in sexuality education, and I've developed a adaptive sexuality curriculum. Working with Hands has allowed me to be able to speak as an autistic, and a lot of organizations state that they hear the community, but a lot of organizations fail to actually allow autistic voices to be heard, and I'm very thankful that Hands has allowed me to do that, and allowing me to be able to speak. It has opened up other doors and avenues, and other opportunities, because people attending, these lectures or conversations have realized that, there are a lot of outspoken autistics who have a lot of opinions, and, there's not a shortage of us. And so they are the first organization that really was able to lift up and amplify my voice, which has now snowballed into supporting other individuals and organizations.
Thank you so much, Marissa. And I too, there's something we do. It's called the DZ, Driver of Innovative Services Implementation, where we recognize individuals who are doing amazing work in the disability community. And recently, I think in the past year, Marissa was awarded the DZ award for the amazing things she does in the community. So we make sure to empower these voices, because they matter. They do. Thank you so much, Marissa. Deb, I'm gonna ask you a similar question to Marissa. Being an IAC member and a very consistent voice in our IAC, how would you say IAC has empowered you as a stakeholder in your community?
So I'm a white female wearing a orange Halloween themed sweater, and just to describe myself a little bit. And I am also a school nurse representing school nurses in the state of Indiana. And being a member of IAC has given me more knowledge about a state plan for autism, for individuals with autism, that I wasn't even aware existed. and for how to apply the latest research that they are doing to my school nurse practice and to the practices of the school nurses that we represent. And I'm really impressed that IAC has reached out to many different stakeholders across the community and across the goals that they are trying to reach to make sure that we have voices for everybody that has a stake in serving individuals who have autism. So I'd say that it's just been a wonderful resource for me to expand my knowledge that I can then pass on to members of my school nurse community who interact with students that have an autism label every day. And so I think it's been wonderful from that standpoint.
Thank you so much, Deb. Deb just, oh, sorry. I'm just now realizing that my camera has been off. I apologize. So Deb reminded me when she described herself. So for description purposes, I am an African American female. I'm wearing a black and white, I think, jacket, I think. Yeah. So thank you so much, Deb. Back to Sarah, and this is my final question to Sarah before I pass it on to my colleague Monica, to continue on with the conversation. I know you kind of answered this question already, but how has LCC impacted your job role specifically?
Yeah, so it has brought to light to me just knowing that I really, like I said, we're a very large school district and we're not perfect by any means. We make mistakes just as every district does. But part of being in the LCC was talking to different members and understanding the importance of the parental collaboration in a school setting. So the people at Hands have helped me get connected with the right people, and we're actually starting our first Franklin Township CPAC, which is a Special Education Parent Advisory Council. That is just getting off the ground. And I would say that's probably been one of the most empowering, impactful things is starting to bring in that conversation. And then I also have a panel of teachers that I work with once a month, being in the administrative level, so that we can hear their concerns too about the district. And it's not just to autism, but all kids with disabilities that have IEPs, and really working to be supportive in those roles. And that's probably one of the biggest takeaways I got from the LCC is working with all the stakeholders in our district, not just the teachers I might work with or just the students. So
Thank you so much. Final question to Marissa. Do you think that these platforms are helpful and should be encouraged across the state and even like across not just the state, but across the country?
Unequivocally. And one of the things that Hands continues to evolve so much, and one of the things I'm so thankful for is that we, they are continuing to expand, the diversity of, autistics like myself, to communicate, their perspectives and perceptions, and whether that requires additional assistance of someone there to be a subject matter expert, but they just continue to evolve and take feedback. And so the community and members, a part of Hands, there's a lot more autistics there, right? So it's not just one or two. There's a lot of people with autism immersed in there. And this should be the expectation. This should be the standard. As an autistic, as a parent of an autistic child, and as a provider in the field, this should be the expectation. And so I'm thankful to be a part of it. So unequivocally, this should be the expectation.
Thank you so much, Marissa. I agree 100%. You can move on to the next slide. Thank you. So I'm going to pass it on to my colleague, Monica, to continue the conversation.
Good afternoon, everyone. I'm Monica. I'm wearing a black top and I'm an Asian female with black specs. So as Boti earlier shared, we went through all the tier 2 awareness and materials and resources we offer. Coming to she went through the tier 1, and I'll quickly go through the tier 2. Hence, we offer a lot of trainings and consultations, and we also offer echo sessions free of cost. So most of the trainings help to train the school professionals, even community providers, paraprofessionals. We do offer week-long intensive trainings, multi-week training, 3-day transition and vocational training, community provider trainings, family and caregiver training, paraprofessional training 1 day. So most of the trainings help everyone, individuals, families, professionals, try to know what is autism and what services, what can be useful to learn about physical and visual structures, so that they can help the individuals and caregivers, or the individuals and families they are helping them, or providing support to those families. Apart from that, we also do echo sessions. Echo is extension for community healthcare outcomes. We focus on conducting echo sessions on autism and developmental disabilities, um, which is a kind of case-based learning workshop where case is being shared, and a panel member, subject matter expert, shares details about a particular topic, and then the panel members facilitate the discussion based on the case and the individual. So it's a individualized case-based learning. And we also provide make it, take it workshops. And as Boti earlier shared, we do um, Let's Talk series, LCCs, all those. So for those who are unable to attend the sessions we try to record the sessions and then make them available online in IU Expand portal. So IU Expand is nothing but a kind of portal where you can enroll and try to learn all the trainings or the materials we provide asynchronously at any time. So Boti or someone will drop the links in the chat so that you can try to join in IU Expand and also learn more about our hands trainings. Yeah. As I told earlier, we offer echo sessions, one of our most impactful tier 2 initiatives. We focus on hands developmental disabilities and autism. So we help trying to connect with individuals and their caregivers, and it's free and everyone can join. We do have participants from various education field, justice field, and even healthcare sessions. We initially started um, doing selecting the topics based on assessing the needs assessment data we collected from long back from 2004 to this year, and then we tried offering sessions for the healthcare professionals. But later on, we extended our echo sessions, focusing on um, several topics like justice, education, healthcare, and then behavior series, community provider series, individual and caregiver series. So this is a quick snapshot from one of our echo session where the case questions are being discussed among the panel members and all the participants. And this is our echo logo. Um, as I told earlier, this kind of focus group helps us to learn a lot during the discussions. And in each and every session, since a case is shared live during the session, it helps us to ask more questions individualized, and also get more feedback from the panel members and subject matter experts. And it's a really great experience, and you'll come to know more about from our autism team members in next few minutes. So, as I told, we are currently offering healthcare, education, justice, behavior, community provider, individual and caregiver series. This is a quick snapshot of what ECHO model is. So, as I told, it's a case-based learning phenomenon. So, there is a criteria for our session. We are following the main echo, which was initially started by University of New Mexico. We are following the same pattern. So initial 10 to 15 minutes, there will be a welcome, followed by presentation by subject matter expert for about 20 minutes. And then we'll do some question and answer session from the participants, followed by a case presentation for around 20 minutes. And then again, we do the question and answer. And it's kind of discussion-based workshop. And then we do the wrap up at the end. So this is ECHO mission. It's to democratize the implementation of best practices for healthcare and education to undeserved people all over the world. And the main focus of ECHO is all teach, all learn. This is a quick snapshot from our participants, percentage of participants of various roles. So as I told earlier, we have a lot of people who are families or caregivers and individuals, around 40% of the attendees. And then we do also have consultants, therapists, case managers, specialists, around 21%. We do have few percentages like 2 to 6% from psychologists, social workers, nurse and physicians, and around less than 15% of educators and also 15% of providers. As you can see, Hands Echo helps to share individual lived experience during the sessions, and also we'll be getting a chance to learn voices of individuals and learn a lot from those discussions. So we also try to send surveys before the session and after the session and try to estimate whether there is an knowledge gain or improvement and their idea about evidence-based practices before and after the session. So this is one of the snapshot of the data we analyzed based on the user rating profile intervention scores, which we collected before the session and after the session. So I think this is a 6 score with 6 score ranging from disagree to agree, and we try to analyze whether the scores are improved or not for all these questions, like whether they like the procedures or practices of evidence-based practices, and whether they are trying to implement those evidence-based strategies they learned during the session, and whether the session was helpful or not, whether they have idea to implement them or not, whether they're able to understand the idea shared in the session. So most of these we notice that there is a increase in score from before the session and after the session. So the orange dots on the screenshot shows these are the scores before the session, so which are below 3.5, and the post phase there is an increase in the ideas or evidence-based practices belief after the session. So this is clearly proves that there is an improved knowledge and also clarity about understanding and trying to implement the evidence-based practices in real life scenarios. These are the quick snapshots of our percentage of participants attending from statewide and also our county-wide distribution. We also have a snapshot of majority of the participants are from US, but we do have attendees attending from all over the world. So these are the quick percentages of participants all over the world. We do have participants from India, Pakistan, Nigeria, Brazil, Chile, Canada, and Singapore. So this is the link, or feel free to scan the QR code to register for our ECHO sessions, and feel free to reach out to astecho@iu.edu if you have any questions, or if you are interested to share case presentations or trying to attend as a panelist or a speaker. Someone can drop the link in the chat so that you have access to that. So I would like to invite our advisory members, Marisa, Maria, and Levi, so they could share more details. I think they all joined as panel members, participants, and also tried to share a few cases. So they'll try to share more insights. What is their personal experience? Marisa, do you want to start first?
Yes, sure. My specifically, sorry, that's my autism. The specific question, what specifically would you like me to answer?
Like, what was your experience attending the echo sessions, and what were your challenges or barriers while accessing to these sessions or any other services, and maybe focusing on the technological barriers or challenges?
So I think you know, I have not personally had many technological barriers with the echo sessions. Um, would you like me to speak on like larger barriers that I've experienced with regard to like my son and technology
Yeah,
or
yeah.
so one barrier and concern that I do have is awareness for which I think the Echo series is helping to bridge this awareness. But I think a lot of providers and educators would benefit from greater awareness on understanding you know, the AAC needs of individuals, and you know, just how I failed to do the description. I'm a Caucasian female with really short hair and big black glasses. And so prompting, you know, this is another thing, like prompting us to be aware of accessibility needs, right? And so I I supported someone recently who was trying to be admitted to a facility, and they refused to admit him due to his need for earphones, which is a sensory need for him to remain regulated. And they refused to allow him to bring in his AC device, which is his voice. You know, you can bring in your wheelchair, but you can't bring in your AC device despite his willingness to, you know, cover the screen so that no cameras or pictures could be taken. So I don't know if I'm going off on a big tangent, but what I'm trying to say is that there is still significant challenges and barriers with regard to awareness of providers and educators. In understanding accessibility needs of the disabled community. And even me right now, like it seems like I have a fidget in my hand. Okay. So those who can't see me with a fidget, I have a fidget, and I always do. Doesn't matter what sort of lecture I'm giving, I always have a fidget in my hand. And if you told me I couldn't have that, that would be very destabilizing to me. And so it is not a toy, it is a regulation tool that I need. And so the Echo series is really bringing awareness to that. And I think that is another component of having autistic speak, because we are able to talk about how you know, important our supports are. So I don't know if I answered that question, but I hope I did.
Maria, would you like to share your experience about attending the sessions and also?
Yeah, well, I think Marissa, you did a nice job answering the question, and I really like the how you brought up the AC device issue with people not always knowing about it, and the fact that it is something that some people need in order to communicate. So actually, I had a thought on that, and let me just see if I could find my notes real quick, so I don't forget. Oh, here we did it. I found it. Okay. So this kind of goes along with the last question that was in an email to me to prepare for this. So my thought was perhaps, you know, an echo series that we could have would be how to help parents understand how to guide their children who are nonverbal or limited with verbal communication to use those communication devices that are technology based. Of course, opening up that, you know, as always, the Echo series is open to anybody who wants to be there. But I mean, I work with parents and helping them understand the special education process. And sometimes I can tell by what they're telling me that they the parents, don't know how to have their child use the device. And a lot of most of the parents that I work with are also primarily Spanish speakers. So we have that going on as well. I'm here in Indiana, and I'm guiding them through the special ed process. Um, so it's tough. Oh, I forgot to describe myself. I'm so sorry. Okay, so let me backtrack. I am a Hispanic woman, upper middle age. I'm wearing a green sweater with a pink headband, and then maybe a little bit of pink is showing through because I have another shirt underneath my sweater, and there's a bookcase in the background. So I hope I answered that question. Yeah, technology, communication devices is something that still needs to be understood by the general public and also by family members whose kids, whose students use those devices.
Would you like to share about topics to date as well, like how you have tried to attend the echo sessions and whether which topics you like the better, whether the live session, how did you felt about attending the sessions?
Who, me?
Yeah.
I like the Echo series. I've been on there as a panelist, and I've enjoyed contributing to the discussion. I hope that I have been helpful. And there is another one that I'm going to be on November 14th as a panelist. It'll be dealing with youth who are transitioning from, the high school to the adult world, which kind of fits me right now or in my life, because my own son, he has autism, and he's a junior in high school, and he's going to be transitioning, in a couple of years from those high school years to being an adult. And we just took him to Purdue University to do some exploring. There was a fair there. We spoke with they call it the Access Center. That's where people who might need some accommodations, they go there and they submit the paperwork and so forth to get the accommodations that they need in college. And so, yeah, it was, I think, a good first step for my son to be exploring the university, to have met some people that he might meet again, to learn his way around campus a little bit. So yeah, it's an exciting time of life for him. I'm very pleased with his progress that he's made. I will say he was kind of sometimes standing in back of me, and I had to prompt him to stand on this, at least on the side. But I did tell the math professors he wants to study math. I said, "Don't worry, he will open up as you get to know him." Typically, he doesn't stand back of me. I don't know why he did that day. Maybe because it's new. I don't know. New people.
Thanks for sharing, Maria. Really helpful.
Hmm.
Maybe would you mind sharing your thoughts and how it is helping you in knowledge transfer in your day-to-day life and representing and joining the sessions?
Yeah, sure. So I've been engaged with Echo as a panelist several times, and the thing that I like most about the Echo webinars is like how much they model the collaboration that I want to see in special education. Because we have people that are giving their life experiences, we have people coming in as panelists who have different professional experiences and have different guidance that they can give the case presenters. And then we have participants who are also in there, like sharing similar struggles that they've been having or strategies that they've tried in their own lives that may or may not have worked. But like that's the collaboration that we're missing in education. My son is also autistic, like we both are. I've been going to IEP meetings since he was 5, and nearly always the IEP meetings are just individual people saying their piece and then bailing. It doesn't go any deeper. There's no connection to what everyone is saying, and there's really no cohesive planning that goes with it. And so, like, this is what I want to see brought into more K through 12 settings, just like people actually talking with each other and listening to each other and figuring out a way to put everything together to make a plan that actually fully supports the student. I forgot to describe myself. I'm sorry. Caucasian, non-binary, femme presenting, hair is dyed blue, and I'm wearing a black and white striped shirt. Was there anything else you needed me to answer, or did I cover everything?
Either of you, what would you like educators or providers to understand about how technology can support your needs or your child needs?
Oh, okay. So technology actually ends up being more of a barrier to my son in school than anything else because like his school operates on Canvas, and within those Canvas assignments there's links to Google Classroom, so he has to follow the Google Classroom link, so he has to have 2 different logins already. And then buried within that Google Classroom link is an assignment link somewhere else, and so he has accommodations to use Notability so he can annotate PDFs and resend them, but he has to send them through email. It's like all of his work takes like 3 different logins and everything is buried within something else. And by the time he actually gets to the assignment, like he doesn't want to do it anymore. I don't want to do it anymore. Like we're both already tired of it. And he's a senior in high school, so like he was supposed to have been taking the PSATs. And he has accommodations for noise canceling headphones. He has accommodations for a scribe. And for the PSAT, he's not allowed to use his accommodations. So he can either go in, he can take his PSAT completely unsupported and probably melt down in the process, or he can skip that day and just not take the test at all. There's really no way for him to do it supported. So I know ESSA, the Every Student Succeeds Act, I know it includes provisions for promoting the use of technology, but I wish people would be more cognizant of how they're integrating it. It's not about like how much or what kind. We need to be more cognizant of like how we're using it. It needs to be more streamlined. There needs to be more ease of use. And we also need to be cognizant of how our students' accommodations impact their ability to use the tech that we're providing. I think that's all I have.
Thanks for sharing, Marie. Do you have anything else to share, Nadia?
I think, Levy, you could probably inquire what accommodations are allowed on the PSAT, and then look at your son's IEP and see what accommodations he has and see if any of those line up.
Yeah, I've always been told he's not allowed to access any of them, which doesn't sound right, but I don't know enough about the PSAT to really question what he can or can't have.
There are some accommodations through College Board that he can have, but the school counselor has to make sure that, like, we make sure those are all sent in and approved months before the testing. So I would double check that. They're very limited. It's not all of the accommodations, but it is very limited. But he should be able to get some depending on what they are.
Okay, good to know. Thank you.
Yeah, but it all goes through the College Board. At least here, our school counselors are the ones who send that off to the College Board with a copy of the IEP and all of that.
Yeah, like we don't even get notified about the PSATs until like a week and a half, 2 weeks in advance.
Yeah, PSAT is just a preliminary. It doesn't do anything really for the college, but he does SAT and ACT. He can also get some very limited accommodations.
Okay.
Is the PSAT untimed? Untimed.
I can't remember. if it's timed, or I think there's parts of it that are timed, but it's one of those where because my daughter just took it, as it gets harder, or as they answer more questions right, the questions get harder, or if they're not answering all the questions right, then it gets a little easier too. So, but there's some that have a certain number. I think there are time components to it, and that is one of the accommodations I don't think can be changed because of that.
Because of
But
the
like small group, I
standardization.
know they can do small group.
Okay.
Thank you so much,
Oh,
Sarah.
Tiffany's
Thank
put
you.
some good resources in the chat too.
Thank you so much. You all played a key role in shaping all our offerings and sessions. Your voice really helped to improve our sessions and benefit the real world with who are with living experience and their families. Thank you. Please feel free to scan the QR code. These are our for the information packets. And if you want to learn more about our hands, try to click on scan this QR code. And these are few more recent updates and pointers. I'll open it for questions.
Thank you all so much. It was really great to hear from our panelists and also our main presenters as well. So we do have a few minutes for questions. So if anyone who is attending has any questions for the presenters or the panelists, please pop those in the chat.
While we wait on questions, I just wanted to say how we just saw a very like practical way the echo sessions run, because Levi presented a challenge and everybody like chipped in on like this is how to do it. And so like if you come to an actual echo session, this is how they run in real life. So I just wanted to make that comment while we wait for questions.
Awesome.
I think that observation, Bodhi, echoes how a lot of our trainings run similarly, where it's about building community. And as Marissa was sharing, really making sure that those that are the stakeholders that we're representing are also at the table in planning or in speaking. And again, just creating more of those cohesive conversations like Lovey was sharing. That is more collaborative than just speaking at, but really speaking among and at in equal voices.